So basically, in my book, the woman with the worm in her had another two stories of infectious diseases. Um, Coming back from where I started off last time, about how I thought it was hard to be a medical doctor, and the things you need to do sort of. The author sort of talks about the heart and talks about a valve and then people getting that one part replaced. So they're talking about the aortic valve. Now this valve is very important because inside the heart, the aortic valve is the last valve that the blood goes to before going to the rest of the body. And thinking about this is really important because it needs to close, because if it doesn't, if the valve wasn't there and the left ventricle would pump all the blood out, some of the blood can still go back in. So that's all of the blood of the body going all the way back in without the valve. So this valve is very important. And it was talking about how people who are having some sort of diseases that would infect that specific valve, and having them needing to have her aortic valve replaced with a prosthetic valve. And the problem with this is that, especially if you're a young kid or you're still growing, your heart will grow, and thus the spot that the valve was in would also grow. I think I explained this last time, I'm not quite sure. Thus, you would need to constantly replace the prosthetic valve because that prosthetic valve is not going to be able to keep up with the growing. Next, it was sort of talking about people who with endocarditis, who one guy was in the veteran hospital, and he was around his 20s. He was kind of young. Then he had to get his aortic valve replaced, but because it was damaged by endocarditis, and also following because he had heroin abuse. So they're also saying that after his endocarditis, the chances of him actually needing to get that valve replaced would be a lot lower if he did not take the heroin like he did. So one day after some of his treatment, he went back to the hospital emergency room because his leg was blue and cold, most likely because of a clot on the new prosthetic valve. Created a clot, and it went all the way down to his leg, and that's why his leg was entirely blue. But the thing was, because he took the heroin, a lot of people were questioning before anything. It's oh, did you take it again? And he would say no, because he really didn't. Or they don't really know, but it could have been the same if he took it or not. So, while they were doing the surgery, eventually they did save his leg, but sadly they could not save his life. So, the problem with endocarditis is that so many people get so many chances with endocarditis, but just after a while, at a certain rate, the person won't survive. It'll be like trying to win a losing battle, but you can't win. It's after it's a losing battle. You know for sure you're not going to win. But now they have new cardiac. That was in the past. Now they have new cardiac echo machines. The doctor was trying to explain. And kind of the one main key that they are looking for with these new machines is that the bacteria goes onto the platelets, and the platelets are sticking to bacteria, so they stick together to the certain type of bacteria, and then they all stick together to this one clot. And so this clot would be hanging off the edge of the prosthetic valve, so this could also cause a clot, and that could be bad. But not just that, what could also happen is that the bacteria seem to be feeding on the edges of the prosthetic valve, so it's inside the stitches inside, it's trying to eat, it's loosening the stitch by stitch every single one stitch. And apparently one horrifying story that she was saying is that one of her patients apparently died in their bathroom because their prosthetic valve was found in their neck.
Oh, man.
Because it went through the bloodstream. It was terrible, and for some reason went up their neck, and they were dying, so they were found dead. Yeah, because of this. But like I said, they have new ways to figure out so that this doesn't happen again, and they have new different echo techniques. So this won't happen again. So I'm very thankful for that. I'm really happy, and yeah, I thought this was really interesting. Yeah, I'm always been interested in the heart, and I thought, if I wanted to learn more, this is definitely a good chapter. I really liked it so far. And actually, the chapter's called Wounded Heart, so it's obviously talking about the heart.
So, what is what did you say the name?
Endocarditis.
What is that?
So it's like a bacterial infection.
Okay.
So yeah, and then
is that to do something with, in the word endocarditis, there is cardiac? So
yeah, there's cardiac, I think so.
So that's probably something to do with the heart?
Endo. I'm not sure what endo means. Maybe it could be inside. Inside, right? Inline. I'm not quite sure, but carditis is probably cardiac, which is the heart. So it could be inside the heart because they can't cause. It's a bacterial infection, yeah.
So what does it do? I'm sorry, just quickly. What is this bacteria?
So this bacteria, what happened is that it sticks to all of your platelets, and you know what the platelets do when you get a cut. The platelets sort of like help rebuild, right?
I don't know what is a platelet.
So the platelet, if you get cut or you get a wound, the platelet helps block the wound.
Okay, I didn't know. Okay,
so
good.
But the thing is, if the bacteria goes to this, the platelets will form because the platelets are sticky to the bacteria.
Okay.
It'll stick on, and then soon there'll be a whole bunch of platelets sticking together with the bacteria, and then just like it can stop the bleeding out going from outside, it can stop the blood flow because it's blocking.
Oh, okay.
So yeah.
This is very bad. That's why you can have blue. That's what you explain. You end up being.
Yeah, the guy had a blue leg. Yeah, they found the clot and they got it, but they couldn't save his life, sadly. So.
Okay. Wow, that's pretty interesting. Yeah.
That's why. Yeah, I really liked it. Chapter.
Okay. Do I have another? No. So you like this chapter? You like the way she said it?
Yeah, I was really interested. Yeah.
Okay, that's good. Thank you.